I'm a prosthodontist. I will be dealing with prosthetics. I have been taking classes for the prostho. Today, we will be doing a quick review for your examination purpose on mostly repeatedly asked questions in prosthodontics and crown and bridge. Okay, so before we start, a happy new year to all of you all. I hope this year brings more glory to each of you. So moving on to the presentation. I have divided it as 3 sections. So first we'll be covering the topics of CD, then we'll be moving on to RPD, and then we'll be going to FPD and implants. Okay, so in FPD, we'll be discussing tooth related and implant related. So we'll be discussing that simultaneously. In CD, the most repeatedly asked questions definitely is about jaw relations, about articulators, residual ridge resorption. Posterior palatal seal have been asked sometimes as short notes, but not as essays. But most commonly is your jaw relation. So either they ask you about jaw relation and orientation jaw relation, or jaw relation and centric relation and horizontal jaw relations, or even vertical jaw relations are asked. And then you have teeth selection. So each of the topic in CD can be asked as a main essay question. But these are some of the most commonly asked questions. So in these, I have just selected those questions. I'll be discussing in detail of them, which is been repeatedly asked over the years, okay, as a short note or essay or short essays. So when we talk about residual ridge resorption, how will you split your answer? So if you have an essay question, you split your question into small parts. So your answer should have a key in front. So this is how you will probably give the key. So at least the examiner looks through your paper and knows, okay, this person knows about this topic. So you will be explaining under each heading. So first you give a short introduction about how the extractions affect the jaws and the jaw bones. What is residual ridge resorption? You give the definition and things like that. Then we talk about the pathology of residual ridge resorption. In the pathology, you have to mention about the Atwood's classification. Then you discuss the pathophysiology, the pathogenesis, epidemiology, of course, etiology, consequences, and treatment and prevention. So generally, what do you call? What is residual? What is residual ridge resorption? It is a term which is used for the diminishing quantity and quality of the residual ridge after the teeth are extracted. Remember to mention both these terms, the quality and the quantity. Both. Mostly we all focus thinking residual ridge resorption means the ridge height or the width is compromised. Not just that, even the quality, the type of bone also tends to change after extractions. Now, this is not an acute thing. It doesn't happen all of a sudden. It's a chronic, progressive, and an irreversible process, with the rate being fastest in the first 6 months after extraction. In case of diabetics, this time span can actually extend beyond a certain period of time. This is the main reason when you give a denture to a freshly extraction patient, the patient usually comes back after 6 to 7 months and tells you that the denture is not as tight